Hey, Dr. Rodman here. Going to give you guys a quick tip of the day in our new Mo zone, the mobility zone here. Basically something I've been talking about a lot today with patients who have shoulder pain, shoulder impingement, which is a pretty common diagnosis, especially for people that do a lot of overhead lifting. Why is it common? Well, basically, the shoulder is a ball and a socket joint. And when we go overhead, if we're in the wrong position, when that shoulder goes up, it starts to rub into the acromion, the roof of the shoulder. And there's a tendon that sits right on top of this humerus here, and it frays and it rips. That's a supraspinatus tendon. So you see a lot of people with supraspinatus tears or fraying or scar tissue in that, and a lot of times it's from improper shoulder mechanics overhead. And also when people get rounded forward, it actually narrows that tunnel where this muscle travels through and makes it smaller, so it's easier for that acromion to rub on that tendon. So basically we're going to talk today about scaption. Scaption is the most stable and the best position for your humerus to slide underneath that acromion. So scaption is when the shoulder, or the scapula, is actually at about a 30 to 45 degree angle out here. And you notice if you try this at home, if you take it 30 to 45 degrees out and you bring it up into flexion and with your thumb back, which is external rotation, you get a lot of range of motion at that end range. But if you bring it in straight like this, it gets stopped and blocked. So what's happening right there is that is kind of locking. The humerus is getting not as much clearance underneath that acromion. But when you get out, it actually drops and slides under very well. Kelly Starrett, guy that I follow a lot, has a lot of great information. He talks about archetypes, which is the most stable position for certain joints. And he talks about this a lot. So flexion with external rotation is the strongest or most stable position for your scapula. So basically some advice today is if you're having like rotator cuff issues, rotator cuff pain, scar tissue there, or impingement, go ahead and just try and feel the end range of motion with your arm pretty close and then move it out. If it feels better out here, that's where you want to be for most of your lifting techniques. Any push presses, any snatches, any overhead movement, you really want to make sure you're out in this plane. A good way to train it is to watch yourself in a mirror to make sure you're getting out in that 30 to 45 degree position. Also, another great exercise you can do is to take a kettlebell, a light one, and keep it straight up. And basically you're going to try to press it over your head. And what it basically does is it forces you to get into that stable scaption position here. If you try to bring it in, it's really hard to balance the kettlebell. So it actually naturally teaches you how to get into scaption. Right there. This exercise was brought to me by Dr. Matt Delalo. Watch out for that guy coming out of school. Guy's excellent. I want to thank Dr. Matt for that. But basically, you're going to take that kettlebell, lift it straight up, and it actually will bring you into scaption and strengthen that position for you. So super easy fix for that. Go ahead and try it. Try it just naturally, see how it feels to bring it here, then bring it out. It should feel a little bit better. Make sure you're doing your lifts like that. If it doesn't clear up, you may need some treatment, so give us a call.